Hello everyone, and thank you for joining our webinar on cannabis and mental health. Happy lunch hour, or good morning or afternoon, depending where you're joining us from. I'm just going to start off by sort of introducing the speakers and myself so that you have a sense of who we are. So my name is Karen Moen. I'm the Program Manager for Mental Health and Substance Use at the Mental Health Commission of Canada, and I'll help to facilitate some of the discussion today. And then our speakers are Dr. Fiona Clement, who is an Associate Professor at the Cumming School of Medicine and at the O'Brien Institute for Public Health at the University of Calgary. Her area of expertise is in evidence-informed policy development. All of her work is completed in partnership with government or non-governmental agencies, including provincial ministries of health, healthcare delivery organizations, and most recently with the Mental Health Commission of Canada, co-leading the team that completed the environmental scan and scoping review of mental health and cannabis. Also here with us is Dr. Rebecca Haines-Saah, who's an assistant professor at the Cumming School of Medicine at the University of Calgary, and although she won't be presenting, she will be helping us to answer some questions later on, and she also participated in the also co-led the environmental scans. So she is a health sociologist working in public health research with a degree in behavioral sciences and addiction studies. Her research interests are in public health and harm reduction approaches to substance use and on amplifying the lived experience and voices of people who use drugs and who live with mental health challenges. And also in the room with us we have Dr. Rob Gabrys, who's a research and policy analyst at the Canadian Centre on Substance Use and Addiction. His main roles are examining the health and social impacts of cannabis use, developing cannabis public education resources from this knowledge, and collaboratively developing cannabis research networks across Canada. Prior to working at CCSA, he completed a PhD and postdoc in neuroscience at Carleton University, where he researched the impacts of stress on mental health. He's currently leveraging this expertise to explore the relationship between cannabis use and mental health. So we have a really great panel of speakers with us today, and I know that they'll share some really excellent knowledge with us. So just to sort of go over our agenda before we go over the agenda, I just wanted to take a moment to acknowledge that here in Ottawa, I'm on the traditional unceded territory of the Algonquin-Anishinaabe people, and I wanted to take a moment to thank and pay respect to the elders and caretakers of this land, past and present, for everything that they have done so that we can gather here today. So, but acknowledging, of course, that many people joining this webinar are coming from across Canada and across the world. So, on our agenda today, we're going to be talking a little bit about the Mental Health Commission and our work in cannabis and mental health, and then going through some of the presentations and a few of the studies and reports that have come out, and then move into some Q&A. So I'll try to keep this introduction to the Mental Health Commission brief so that we can get right onto the presentation. So in case you don't know, the Mental Health Commission of Canada is a pan-Canadian not-for-profit organization funded by Health Canada, created in 2007 in response to a Senate committee recommendation. And our mission is to raise awareness of the mental health and wellness needs of Canadians and to help bring about change in the mental health system. Some of our work that you may be most familiar with is the Mental Health Strategy for Canada, Mental Health First Aid, Headstrong, programs such as that. So in Budget 2018, the Mental Health Commission received funds to help address the research and knowledge gaps in cannabis and mental health. Building on existing work and past research, our first piece of work was to develop an environmental scan and scoping review of cannabis and mental health in Canada. So we funded a team of experts from the University of Calgary to do this work, and this is what Fiona will be speaking to a little bit later. And so our work in cannabis and mental health really takes place in three areas. We are trying to inform and invest in research, to share and mobilize knowledge, and to center lived and living experiences. And we're trying to center lived and living experiences through community-based research investments, as well as hosting community-based research forums. Our latest forum was in Ottawa in July, and then most recently we hosted an Inuit forum in partnership with Inuit Tapiriit Kanatami and the Canadian Centre on Substance Use and Addiction in October, so earlier this month. And if you're interested, the report for the Ottawa forum that happened in July is on our website. And so Just before moving on to Fiona, I just want to take a quick moment to thank our partners, and this is certainly not an exhaustive or comprehensive or final list of our partners. Partnerships are always evolving, but just wanted to take a moment to thank these folks who have sort of helped us in our work and who we continue to look forward to collaborating with moving forward. So with that, I will turn it over to Fiona. So again, Fiona is one of the authors of the Cannabis and Mental Health Environmental Scan and Scoping Review at the University of Calgary. So I'll turn it over to Fiona.
Good morning. Thank you very much. So it's a pleasure to be sharing this work with everybody on the line today. I'm, of course, just representing the team. So this report, we were asked to set out kind of the current state of knowledge is cannabis and mental health. And wanting this to be a very, very broad topic, a very, very broad report, I had the privilege of co-leading this team with Dr. Rebecca Haines-Saah, who is also on the line for questions later, Dr. Matt Hill, who you see in the middle, the Beard Fellow, and Dr. Scott Patton, who is on my far right with the tie, very fancy. And I just would like to acknowledge the breadth of expertise that that team brings forward. So Dr. Hill is a bench-side scientist, so we were able to dig into some of the research that looked at animals and the more basic fundamental science knowledge that is known around cannabis and mental health. Dr. Patton is an epidemiologist and a psychiatrist, so we were able to look at studies that included a clinical population with an already diagnosed mental health disorder. And then, of course, Dr. Haines-Saah, who brings public health and population health, allowed us to dive into that area of knowledge, really focusing on populations and that's what we know there. Also featured in this picture are the two people who really did all the work and deserve all the kudos, Brenly and Ruth, who are two fantastic team members who really put the boots on the ground for this report. So very grateful to have this team assembled. So what did we do? We structured our work into three separate parts. In the first part, we looked at what kind of Canadian data assets are already out there and could be leveraged by researchers to understand the context of cannabis use in Canada pre-legalization and on an ongoing basis post-legalization. We also did the same kind of scan with the international data sets, recognizing that although we have a short history with legalization globally, there are other countries who have Thank you. There are other countries who have legalized before us and perhaps data assets that we could easily access and utilize to learn to figure out what should Canada be watching for as we move forward here. And then lastly, we looked at the published literature to try and synthesize what do we already know about cannabis and mental health, what's already published and what has already sort of been established over decades of research in this area. It is a very big report, and so I'm going to give you a bird's eye view today of each of these different pieces of work and invite you to look at either of the reports that have been published, the full report or a more digestible report that the Mental Health Commission helped create for people who weren't interested in all the p-values and etc. So moving into the Canadian data assets, we did identify that there are many Canadian data assets that have been gathered over the very long term here in Canada. They each have different populations. They are all held by Statistics Canada, and many of them, the light blue ones, have now stopped their collections, and the dark blue in this figure have ongoing data collections, meaning that they could be used pre and post legalization. And just to highlight some of the depth of this data, I'm going to talk to us about the Canadian Tobacco, Alcohol, and Drugs Survey, and share just some analysis we were able to do with the public access file. So this is a file that anyone could access publicly to create these kinds of figures. So I'm choosing to highlight with you the prevalence of cannabis use by age over the past 12 months, pre-legalization, so 2013 to 2017. And I'd like to draw your attention to both the blue lines. So the light blue line in the middle of your graph there is the 15 to 17-year-olds. And you'll notice that that's decreasing over time. And so this is a trend that has been noted by other people as well, but here we're able to show that. And then of some concern is the dark blue line at the bottom, which is those over 65 years and older. And this has also been noted by other people. But whilst it's a very low absolute number, you do see an upward sloping trend in that group. And it's rising quite steeply, which, again, although the absolute numbers of use are very low, the increase is quite a concern, and I think something that we need to be mindful of as we move forward, that our senior population or our older population are using cannabis and are using it at an increased rate than in 2013. The other thing we were able to do from this data, and again, this is from the public use file, was to do a crosstab or an associative analysis of self-reported mental health by cannabis use. Again, this is 2013 to 17, and this is a one-question evaluation of mental health, and they simply ask, how would you rate your mental health today? And there are 5 choices that you can respond with: excellent, very good, good, fair, and poor. And then we just categorize that by whether they reported using cannabis over the last year, ever or never. Now, importantly, this is just an association, meaning that we do not know anything about the direction of this association. But what you do see here in this graph, if you look at the yellow and purple bars at the top, is that there is an association between past year cannabis use and poorer mental health. So again, we know nothing about the direction, but we do see an association here, which is something that we need to pay attention to and understand more about. Turning to the international data set, again, we do have a very short history globally of legalization, with the first state, legalizing in 2012. But looking at all these things, we do have international data sets, again, which provide pre- and post-legalization data, which of course we won't have in Canada until now and moving forward. And these are busy graphs, so I apologize for that, but hopefully I can still make my point. On the left-hand side, you have each line representing a different jurisdiction with legalized cannabis, and the rates, the prevalence of past year cannabis use in those 12 to 17 or 13 to 17 in Uruguay as the cohort allowed. And then the vertical dotted lines represent the point in time where legalization occurred. So if there were drastic changes in use associated with legalization, we would expect to see big changes in the direction of the line as it hit those dotted lines. And importantly, we don't really see that. And similarly, I've put in a graph for those over 50. And here again, whilst you don't see dramatic changes with legalization, you do see increased trends generally, whereas in the younger group, you're seeing generally stable or perhaps a decreased trend. So again, something for us to really think about as we're concerned about who is using cannabis and who we should really be developing safe and lower use guidelines targeted towards. Okay. Turning now to the published literature and the scoping review, we did find a very large literature of cannabis and mental health studies across a wide variety of methodologies and disciplines. So we found 1,047 studies in total and broken down into these different categories. So you see that the mental health in a community population, meaning a general population with an unknown mental health status or an undiagnosed mental health disorder, is the most common, with 493 studies published in that area. And I don't have time to show you all of the different studies and findings in each of those buckets, so I'm just going to focus on our takeaway messages and the strengths of each area and the gaps that we identified. So focusing first on the animal studies in the first upper left-hand box, we did find 177 studies that focused on mechanistic understanding of mental health and cannabis use within an animal experiment. And importantly, 4 of those are from active labs in Canada. We have 4 active labs in Canada, which is a great infrastructure that we could perhaps enhance and build upon as we try to understand more in this area. The majority of these studies reported using more than 6 animals in each experimental arm, which can be taken as a very rough marker of quality. And about 50% of these studies employ rats as their experimental animal. So from this, some of the areas and gaps that we still need to focus on is many of these studies administered the cannabis substance with an injection, which is a very uncommon, if not unused, mechanism for humans. So that really questions the generalizability of these studies and how these studies would translate into a human population, knowing that for the most part we're ingesting our cannabis as opposed to injecting it. And very few of these studies examine cannabis in its extract form. Many of them are synthesized cannabinoids or other extracts from the cannabinoids. So again, questioning the generalizability of these studies into human populations. When we flip over to the human studies in the lower left quadrant of this table, we did find a very robust literature that assessed the relationship between community populations of adults, very generally, those over 18, across a wide range of mental health outcomes. People with schizophrenia spectrum disorder were the most commonly assessed clinical population. Other populations were also assessed, but the schizophrenia spectrum disorder population is the most robust literature. And 2 of our major Canadian data assets have been used and reported upon in the published literature, which is a good thing. Some of the gaps that we have identified in this literature, really that primarily this literature reports limited research that uses a design that could establish directionality of the relationship. So often these are cross-sectional studies, meaning one point in time where you're measuring the mental health outcome and the cannabis use, and so you have no idea which one preceded the other, or they're using a longitudinal design, but different populations of people over that time. So very hard to draw causality and directionality of relationships. There is limited research in both the community and the clinical populations, so those with unknown mental health disorders and diagnosed mental health disorders. Generally, they're just reporting on an adult population. There was very little research that considers specific populations that might have unique needs, like, for example, those who have experienced adverse childhood events. Very limited research also adopts a sex and gender lens, and when it is adopted, there was no clarity about which lens they were adopting. So often people would talk about doing a gender analysis, and it wasn't clear if they were actually doing a gender analysis or a sex analysis, and vice versa. And then both the qualitative and the quantitative methodologies primarily adopted a harm lens. So they were looking for negative effects and framing the whole study around cannabis and mental health being a negative association. And very few of these studies stepped back and had kind of a more neutral framing or considered a positive lens when considering quality of life and well-being. So where to from here? So in the report, we have several kind of ideas about how we can move forward from where we stand today. First and foremost, we think that we need to strengthen and support all methodologies across all disciplines of research. Whilst there is a large number of studies published, the things that we know, in quotations, still remain relatively few. And so we do need to work across all of the disciplines to really increase our understanding. Importantly, I think we need to focus on the understanding of the directionality and the causal nature of this relationship. And by that I mean really understanding whether it is cannabis use that causes mental health disorders or whether those who have a mental health disorder tend to use cannabis more and it's driving it the other way. Disentangling that relationship and the nuance that is required for that is a key piece that we need to move forward and focus upon. Of course, Canada has an opportunity to lead here. We are the second nation to fully legalize cannabis, and that gives us a huge competitive advantage, if you will, compared to other countries where research with a controlled substance has different rules and has many barriers, appropriately so, to studying it. So really promoting research in Canadian research through funding and increased partnerships will really help amplify our research. We do have already established data assets that can be used for rapid access, rapid analysis. We have public use files that could be accessed by anyone. We have what's called micro-use files, which do have some barriers to access in that you need ethics in place and you need to go to one of the universities, but many options to have some rapid analysis done. And we need to continue the production of these data sets and make them available for research. Embedding the lived experience of people who are using cannabis across all methodologies will amplify and enhance all of the research that's being done. We also need to focus on the unique needs and possibly the differential relationships that are within the different communities. So it's not enough to just focus on adults anymore. We need to be much more segmented and thoughtful about not just aggregating to the mean and considering each of these groups differently and understanding them differently. And then lastly, we need to really focus on placing a relationship between cannabis use and the mental health within the complex context that it exists. Meaning that often when we were looking at all of these studies, they would consider cannabis use as one factor amongst several, including co-use of other substances, adverse childhood events, exposure to trauma, these kinds of things. And often when you were looking at all of the odds ratios, of course, the cannabis odds ratio is there amongst all these others, and it's taken out of context of this very complex human condition. And the general harms lens that's being applied to this literature is not nuanced enough to really understand this issue fully. Lastly, I'd just like to leave you with some references. So where can you find these reports? They are also on the right-hand side of your screen, but here are the web links for those who would like to go online and download them. Thank you, and I look forward to your questions later in the webinar.
Okay, thank you so much, Fiona. So I'm just going to make a quick note that I forgot to note earlier, that if you have any questions throughout the webinar, you can definitely ask some questions in the chat box. So we'll be taking questions at the end of the webinar. So right now I'm going to pass it over to Rob from CCSA. So the Mental Health Commission has been working closely with CCSA. CCSA also received funding from Budget 2018. For cannabis and mental health, so just continuing that relationship. So I'll pass it over to Rob.
Thanks, Karen, for the intro. So I will be presenting on a recent report that we released back in April, I believe, on the relationship between regular use and mental health. Everyone might notice that the two reports are a little bit different in terms of style and content. But importantly, the messages, the key messages and the conclusions are quite the same between the two reports. So I think it's worth reading both of them and sort of in order to get a better understanding of cannabis use and mental health in general. Before I move on to the report, I wanted to quickly introduce CCSA just for those individuals who might not be aware of who we are and what we do. We are a not-for-profit organization that was created by an act of Parliament in 1988 to provide national leadership in addressing substance use in Canada. And we do a variety of different things at CCSA, which are typically clustered into 4 core functions, and that includes providing national leadership by directing attention and resources towards emerging issues and trends on substance use in Canada, bringing people and knowledge together, synthesizing and generating timely evidence to inform practice and policy, and ultimately to mobilize knowledge to various stakeholders. We do have a number of priorities at CCSA, which include alcohol, opioid, stigma, and of course cannabis, and that will be the topic of conversation today. So as mentioned, one of our main objectives at CCSA is to synthesize, translate, and disseminate the available evidence on substance use to various stakeholders, which includes researchers, healthcare providers, and policymakers. And within cannabis, we do this through our Clearing the Smoke series on cannabis. So these are essentially short review papers that focus on the impacts of cannabis use on various aspects of health and functioning. And some of the other reports that we have include cognitive functioning, cannabis use during pregnancy and breastfeeding, cannabis and impaired driving, and the one that I will be speaking to today is on regular use and mental health. So each report is written by a subject matter expert and is externally reviewed by experts in their respective fields, and the one written that I'll be presenting on today was written by Dr. Sarah Konefal, Dr. Amy Porath, and myself. Before getting into some of the main points within the report, I wanted to quickly define regular use, heavy use, and cannabis use disorder. Regular use typically refers to weekly or more frequent use over extended periods of time, and some other terms that have been used to describe this frequency of use have been frequent, chronic, and long-term cannabis use. Heavy use, by contrast, refers to daily or more frequent use and is often associated with dependence or cannabis use disorder. Some of the early warning signs of cannabis use disorder include craving for cannabis, tolerance to its effects, and withdrawal following its use. And more severe forms typically impact social and occupational functioning and are associated with physical and psychological problems caused by cannabis. In terms of psychosis and schizophrenia, there is strong evidence linking regular cannabis use to these conditions, especially among individuals with a family history of psychosis and schizophrenia. Cannabis use typically worsens clinical and quality of life outcomes for individuals suffering from these conditions, and about a quarter of individuals with psychosis or schizophrenia would go on to develop a cannabis use disorder. Another and equally important point that has often been missed within the public health messaging is that while smaller, there still appears to be a risk for developing psychosis or schizophrenia even among individuals without a family history of these conditions. For instance, it was found in a large longitudinal study that individuals who began using cannabis prior to the age of 18 were at 2 times the risk of developing schizophrenia, whereas those who have been using heavily for extended periods of time were at 6 times the risk of developing psychosis or schizophrenia. And there's also a growing body of research indicating that the use of high THC products increases the risk of both conditions in a dose-dependent manner. And this is particularly important now, given that cannabis extracts, some of which have very high levels of THC, are now legally available. In terms of depression, the research seems to be typically mixed. Some studies have found an increased risk of developing depression following cannabis use, while others have not. But a recent review and meta-analysis shows that the risk of developing a first depressive episode seems to be relatively small, meaning that most individuals will probably not develop depression, but a small percentage of individuals will. An interesting finding, however, seems to be that cannabis use has been associated with a specific depression profile, and it is one that is characterized by anhedonia, which refers to lack of pleasure in things that were normally pleasurable, and motivational disturbances. So that seems to be related to a lot of the research coming out on the relationship between cannabis use and cognitive functioning as well. But we don't know whether or not cannabis actually leads to the specific depression profile, or if individuals with anhedonia or motivational disturbances are more likely to use cannabis at a future date. And what we don't know in terms of causality is whether the chemicals in cannabis actually, cannabinoids, whether they actually lead to depression, or whether cannabis use might reflect a behavior that is linked to depression. We also don't know whether there's a third variable, including something like early life trauma, personality variables, or genetic factors that predispose individuals to both increased risk of depression and to use cannabis. But what we do know is that the link between depression and cannabis use disorder appears to be reciprocal, meaning that individuals with depression who use cannabis are more likely to develop a cannabis use disorder, which ends up worsening depression over time. In terms of anxiety disorders, we don't actually know all that much. It seems to be a relatively small area of research currently, and it is pretty mixed. So it seems that for most individuals who use cannabis, the risk of developing an anxiety disorder is somewhat low, but individual differences seem to be pretty important in this case. For example, Several studies have shown that being female, carrying certain genes that are related to depression and anxiety, and initiating cannabis use early in life makes an individual more at risk for developing an anxiety disorder versus those who don't have these characteristics. But I think what's the most important point of this slide is while the risk for developing an anxiety disorder is relatively low, individuals with anxiety who use cannabis typically are at a higher risk of developing cannabis use disorder. And this is especially the case among individuals with social anxiety, which has been suggested that individuals with social anxiety might use cannabis to sort of deal with their symptoms or manage their symptoms in social situations, which ends up reinforcing cannabis use. And then over time, this ends up promoting a cannabis use disorder. In terms of post-traumatic stress disorder, PTSD, we don't know very much, including whether or not cannabis use predisposes someone to developing this condition. We do, however, know that cannabis use, especially heavy use, is quite common among individuals living with PTSD. And there is preliminary and preclinical evidence to support cannabis use for managing certain symptoms of PTSD, including sleep. But overall, it seems that cannabis use is associated with more or poor mental health outcomes among individuals with PTSD versus some of the benefits that might sort of come with it. And for the last point, individuals with PTSD often present with problematic cannabis use and are at a greater risk of cannabis use disorder more than it seems that other mental health conditions. So this sort of brings me to I think what's the most important slide. And Fiona has mentioned some of these already. The measurement of cannabis use has been somewhat limited. Most studies to date have used frequency of cannabis use exclusively to measure cannabis use. And while this might be an important predictor of mental health outcomes, it might not be the only one, and it might not be the best one. As an example, you might have two individuals using cannabis daily or almost daily, but they might be using products with different levels of THC versus CBD, different quantities. One individual might be using high-potency cannabis extracts, while the other person is using dried cannabis. So I think it might not be surprisingly that the health impacts of cannabis use for both of these individuals might be very different. Causality has been quite difficult to establish as well. With the exception of perhaps psychosis and schizophrenia, we don't really know what direction the link is between cannabis use and certain mental health outcomes, and we also don't know what the role or to what extent do cannabinoids actually predict or lead to any of these mental health disorders. And Fiona touched on the last one. Individual differences have not fully been explored. Most studies have been relatively small, making it difficult to look at sex differences, gender differences, differences across different age groups. So I think this is definitely an area that needs to be augmented in the future. So to sort of sum up, there is strong evidence linking regular cannabis use to an increased risk of developing psychosis and schizophrenia, especially among individuals who start using cannabis early in life, use high-potency cannabis products, and who use heavily. The evidence linking cannabis use to mood and anxiety disorders is much less clear. We don't really know which direction this link is. And regular cannabis use seems to do more harm than good for individuals experiencing mental illness, and this is particularly important given that the cannabis use is now a lot more accessible than it previously was, which makes public education directed towards individuals living with or at an increased risk of mental illness essential. And hopefully with effective and sustained public education, individuals will be informed, better informed to make decisions regarding the costs and benefits of cannabis use. So to end off, I just wanted to quickly go over some of the work that we're doing at CCSA around public education. Some of you might be familiar with our Talking Pot with Youth guide, as well as our Substance Use in Canada report on the effects of cannabis use and the effects of cannabis use during adolescence. But we're also working on a variety of new resources around the new cannabis products. One that you might have seen is our inhaling versus ingesting infographic that has been quite popular recently. We also have several fact sheets around cannabis extracts, edible cannabis, and also safe storage. And in the future, we're working on a couple of resources for older adults as well as drug interactions, so stay tuned. And I just wanted to end off by thanking the MHCC for hosting this webinar. It's clearly a very important topic and one that deserves significantly more attention. Thank you.
Thank you so much, Rob, and thank you to all the presenters and to the participants for we're getting a lot of questions in, so there's a lot of engagement on this, and so so we'll just move into the question and answer period right now, and we did receive some questions in advance, and so maybe we'll go through a few of those beforehand, and then we'll start to answer some of the questions that are appearing in the chat box. So, sorry, I was just trying to change the slide. So, so one of the questions we received, maybe I'll ask this question to Fiona, is whether or not, so the question was, are you aware of any studies to date focusing on the positive effects of cannabis use strain by strain on mental health? So Fiona, is that a question you'd be comfortable answering?
Yeah, thank you very much for that question. So of all of the studies that we synthesized, and I will note that the studies we included in our report ended in April, so there may have been some studies published since, but among the over 1,000 studies we included, only 2 assessed any possible positive associations with cannabis and mental health. So a very under-researched area. And just anecdotally, I'll share my thought, people continue to use cannabis, and so one would think if it was an absolutely horrible experience, one would perhaps not use it again. So I think that there is a big piece here that we just don't understand or have not spent the time studying around the positive effects of cannabis and mental health and how people are framing their use. And I'll also put a plug in here for the importance of the lived experience informing that conversation to really help us understand what are some of the positive effects, how are people experiencing that, how are people describing that, and we do need to study more in this area.
Thank you so much, Fiona. And another question that we received was about any key messages that public health should be sharing with the general public about the use of recreational cannabis. So is that so? Maybe I'll ask that question to Fiona before we move on.
Yeah, thank you for that. If it's all right, I'm going to toss that over to Rebecca because she's much better positioned to answer that than I am.
Okay, perfect. Thank you. Oh, Rebecca? Maybe if you unmute your line.
Okay, I'm unmuted. Could you
okay.
repeat that because I was answering online questions?
Oh, sorry. Thank you so much. It's just a question about what key messages should public health be sharing with the general public about the use of recreational cannabis?
Yeah. I think we have some great lower risk guidelines that are based on a review of the evidence of well that have been updated by 2006, and that was led by CRISM. And they have the endorsement of public health authorities and medical authorities in Canada. I think like any other substance, it carries risks. So if you want to avoid all health risks to physical and mental health, it's better to not consume. But if you are going to consume, you can choose safer modes of consumption, thinking about the health risks of smoking if you're smoking frequently, thinking about the risks for dependence and cannabis use disorder if you're using high THC products and using those intensely, like using extracts. So, I mean, it kind of makes practical and pragmatic sense for all cannabis products to start low and go slow, and to really monitor your use and to look at how it's impacting your functioning in your daily life and your other health conditions. And certainly now that we're in a context of legalization, you should find a physician that's open to talking about your own unique genetic or health risk profile around what you may have a predisposition for in terms of mental illness, and have that open and honest conversation with a medical professional, right, about the risk.
Thank you so much, Rebecca. And maybe a follow-up question to that we received in the registration was that youth often say they use cannabis to manage stress, anxiety, and other mood symptoms. How do we balance the conversation between their perception of benefits and the possible longer-term mental health consequences?
Yeah, I guess I will take that question. I think it's interesting to think about why youth are reporting turning to cannabis and what we need to do to support them in conversations about mental health and mental health services. And in our TRACE study, where we spoke to 86 youth across Vancouver, and these were youth who were 13 to 18 using cannabis daily, is that some young people turn to cannabis just to get up in the morning and get to school and to be able to tolerate the stressors of the day. That's not positive, but it shows that they're wanting to be in school, that they're experiencing stressors and a lack of support in the school environment, and they don't have other solutions, right? So when we know there's just a shortage of appropriate and available supports for young people, we really have to look at addiction and mental health services for youth overall to understand why some youth engage in that behavior, and not shame and stigmatize those choices at that time. At the same time, I think we know that the scare tactics and telling youth to abstain, or you will have severe mental illness and you will, suffer later consequences, that doesn't resonate with young people in terms of their developmental stage. So it's a very nuanced and tricky conversation to have with young people that requires a lot of diplomacy, a lot of meeting youth where they're at, and a lot of sort of busting the stigma and not advancing myths, even as we want to protect them. And I think the Talking Pot with Youth Guide and other approaches from the CSSDP do a good job of having a new conversation now that we have legal cannabis.
Thank you again, Rebecca. And then another question that may relate to this discussion on youth is a question for Rob that we received in the registration again. So the question is if there are any study results linking prefrontal cortex development and the effect of cannabis on mental health.
Hi, yes, good question. There have been a number of neuroimaging studies showing that cannabis use, especially when it's been initiated early in life, is associated with reduced volume in the prefrontal cortex and various other regions, including the hippocampus. And these brain regions are involved in the development of anxiety disorders and depression as well. The only issue is they're correlational. So we don't know whether cannabis use actually had any sort of direct cause in altering these brain regions in terms of size or structure, or whether these sort of brain differences preceded cannabis use. And I should also mention that not all studies have found these sort of effects. So it is an interesting question, and I think we do need more longitudinal studies looking at neuroimaging to see whether or not cannabis or any sort of cannabinoids might impact the prefrontal cortex or regions that are sort of involved in mental health.
Thank you, Rob. And another question that came in on the in the chat box is if there are risks of use, what are the risks of cannabis use and bipolar I disorder?
Yep. So this has been a pretty understudied area of research. We don't know actually very much. Right now it seems that the risk for cannabis use on bipolar I isn't very great, but we do know that individuals with bipolar disorder are at an increased risk of developing problematic cannabis use. So I think we definitely need more research in that area.
Okay, thank you so much. And I have another question for Fiona here. Have there been any studies highlighting the differences between the way different modes of consuming cannabis, for example, oils, edibles, smoking, or vaping? And are there any studies about the difference between high THC or high CBD cannabis?
Thanks for that question. Great question. So the literature that we synthesized was very non-specific in terms of mode of consumption, amount of consumption, frequency of consumption. So in the majority of the human studies, in the community and the clinical populations, they often just asked, have you used cannabis in the past year, or have you ever used cannabis? So it's a very general question, recognizing that in that, the people who say yes to that, some may be using cannabis daily, they may be smoking it, some might have, smoked once over the last year, some might have had an edible consumption. And so we really don't know a lot from this literature about the different modes of consumption, the different levels of THC and CBD, and how those, how the specifics of how you consume or use cannabis affect the associations and mental health outcomes.
Thank you so much, Fiona. And then I believe there's another question that we have for you, if you're okay with answering it. It's about how can researchers refine their research to explore the causality of psychosis, referring to the discussion earlier around the some of the links to psychosis. So Fiona and Rebecca, I feel like that's a question for you, and if you're comfortable answering, please go ahead.
Sorry, I'm just taking my time to gather my thoughts there.
If you
go ahead,
prefer,
Rebecca, if you're ready.
Yeah, are you saying how can we know more?
Right. The question is how researchers can refine their research to explore the causality.
Yeah. I think that disentangling causality when there's complex and confounded behaviors like severe mental illness is very tricky. It's very challenging and requires looking at the question in a number of different ways to triangulate the evidence. And I think that it's confusing for non-researchers and researchers alike because the field is very divided, and as I noted in the chat, there's some researchers in the UK who absolutely already believe they have evidence for a causal link. And then when we look at the evidence across meta-analysis of reviews such as ours or the National Academies of Medicine, it becomes clearer that we don't know for sure. Keeping in mind that, this is a 1%, schizophrenia is a 1% illness in populations. And so when as a public health scientist, the thing that's most compelling to me is to consider in jurisdictions that have legalized, you don't see a dramatic spike in the presentation of this, although you do see some substance-induced psychosis which is temporary and not permanent when people are ingesting high THC products, sometimes users that are naive to cannabis. So I think we need to be cautious. What I always take from the literature is something one of my colleagues wrote is that, there is a clear and robust relationship. We know that for sure. But I think it's too preliminary in my mind to say we definitely have a sense of the direction. I'm sorry that can't be more clear, but that's my take on it right now from where I sit.
Thank you so much. Another research-related question that we just received was one relating to, and maybe this is not a question we can answer on here, and if so, that's completely understandable because it's a question that's a little bit bigger than what we're talking about right now, but the injection of cannabis in animal studies, and I know that there is a little bit about this in the environmental scan and scoping review that talks about the importance of research reflecting regular use or typical use, and so just a question about why studies inject cannabis.
That's a great question. Thank you. So when you're thinking about more bench-side research and an experimental design, the idea is to try and control and be as exact as you can in terms of what is being tested in your laboratory. And so when you directly inject into an animal, you have complete control over how much of the content and how much of the different chemicals is going into their systems and where it's going in. And as a researcher, that's incredibly important so that when you see differences between the animals that were injected versus not, you know it's not due to different levels of consumption, for example. And so you can imagine if you're exposing an animal to vapor, for example, or like a smoked environment, the animal might breathe in differently, they might absorb differently, and so you have variables that are outside of your control that may affect your findings. So I think the injection really comes from the discipline of experimental science in the bench science lab. Increasingly, as we move forward, and remembering that we just legalized very recently, and so the research community is still mobilizing and moving forward, there has been a push to move away from injection administration in the bench science context and have what's called vapor chambers, which can still allow you the same kind of control. And they're a very fancy machine, and I'm excited that we now have one at the University of Calgary, but can give you that same kind of control over how much an animal is inhaling and the extent that they're exposed without injecting it. So I'm excited to see the field moving forward, but really in the past I would imagine the injection comes from this very disciplined approach to basic science.
Thanks so much, Rebecca. So we have, I'm going to try to sort of not combine two questions together, but ask them around the same time because they're related. So one question that we had received in the registration before the webinar was whether or not there's any comparisons between cannabis and opioids in pain reduction and downstream impacts. And then as a follow-up question to that, whether or not there's any research on cannabis for pain, particularly with seniors and the relationship to mental health there. So I know that that's sort of a large packaged question, but I was wondering if, Rebecca, you might be comfortable answering that.
Yeah, so I think it's a quite confusing landscape because we've heard a lot in the popular press and certainly from cannabis advocates about the potential benefits of cannabis in regard to opioid use disorder, opioid addiction. And, we do have a large trial running in BC by my colleague, MJ Malloy, who's, at UBC and affiliated with Canopy Growth as a scientist there, thinking about for people, in a marginalized population who have severe problems, was there some benefit in terms of assisting them when they're transitioning off opioids and going through withdrawal and mitigating that? That doesn't mean that we have anywhere near the evidence that this would be a first-line treatment or anything more than something people report sort of having some adjunct benefit anecdotally. And then we have population studies, at the ecological level in states that have legalized, showing this relationship between maybe the harms of opioids decreasing when the state legalizes cannabis. But then other science recently that sort of has shown that not to be a valid relationship. So my take from what I read and what I see is that it's still quite unclear, but there's a lot of interest in that from the patient-reported benefit around pain, but just not enough sort of gold standard evidence to say, yes, we can say anything conclusively, and a lot of people who say there's not a lot of evidence of benefit in other than what some patients are reporting. So I think the main benefit sort of narrows down to improved sleep for people with chronic pain and other health problems. And other than that, I just don't think we have the science to say what the benefits are.
Okay, thank you so much. And I think that I'll ask one final question to our presenters and give everyone the opportunity to answer. And then any questions that we didn't get to, what we'll do is we will take a look at them, and then we will provide a document afterwards that tries to address and answer any of the questions that we didn't get to. So if we didn't get to your question, I apologize, but we'll try to do so following the webinar. So this question is sort of again on that point of benefits. Did you, to all the presenters, find many studies on the positive impact or areas where mental well-being improved, especially given that many consumers see cannabis consumption as beneficial, noting that in many jurisdictions contemplating legalization, they are focused on the negative aspects. So that's just a question to sort of close off related to the previous question.
Maybe I'll start. It's Fiona. So in our scoping review and environmental scan, no, we did not find many studies. So as I said earlier in the webinar, we only found 2 that assessed the positive effects of cannabis and mental health, or the association. And so the vast majority of this literature has adopted a harms lens and really focused on quantifying or trying to quantify the negative associations between cannabis and mental health. I do think when we're thinking about within the context of other places legalizing, you can understand from a policy framework or from a regulatory framework why you might be focused on trying to adopt being cautious in a way that you sort of try and protect or limit your exposure to any possible negative effects as a society. And so in many ways it doesn't surprise me that this negative lens have been almost universally applied to the conversation. But I think, you know, moving forward and within this context of legalization, again, I go back to in Canada, I think I might have this stat wrong, but I think it was about 14% of Canadians who reported using pre-legalization cannabis. And so, you know, if there's not some kind of positive experience there, that's a very high number of Canadians to do something that's absolutely awful. So I think we need to understand more about this and really adopt a much more nuanced lens to all of our research and thought moving forward around like what is the association without framing it and assuming that it will be negative. And open the floor to Rebecca and Rob to share their concerns as well.
I've spoken a lot, so let's hear from Rob first.
Sure. I agree with Fiona. There hasn't been as much of a focus on the benefits, per se, of cannabis on mental health versus the harms. But there is a little bit of research out there, and I think it's time that we sort of reframe the question now about whether cannabis itself has a potential for having a therapeutic effect on mental health, and talk more specifically about cannabinoids, or the chemicals that are within cannabis. Because it seems that most of the harms that are associated with cannabis are related more to the THC in the plant, whereas CBD might have some therapeutic effects for certain mental health conditions. So for example, there is some research, although it's relatively preliminary, on CBD providing some symptom reduction in schizophrenia. It seems to also have positive effects on reducing anxiety for individuals with generalized anxiety disorder. So yeah, I think we need to ask the question a little bit differently now and gear it more towards whether CBD or THC, THCA, any of these sort of cannabinoids, whether these separate substances sort of have a benefit to certain mental health outcomes, and whether it benefits some individuals more than others.
Okay, thank you so much, Rob, and thank you, Fiona and Rebecca. Thank you to all of our speakers, and thank you so much, participants, for the excellent questions. We're going to sort of move into an evaluation now, so if you have a few minutes before exiting the webinar, if you'd just be able to fill out the evaluation. There's some questions here about your satisfaction with the webinar, how well the content was presented, was it timely in relation to the information that needs that you have, and has your level of knowledge regarding cannabis and mental health increased? And so thank you so much, everyone, for joining us, and we hope to see you again in the future at a future webinar.